computer. Okay, so I'm going to turn it over to Lexi at this point to get things started. And we're going to be discussing HIV and STDs today. Get the screen up. There you go. It looks great.
All right, everyone can see the screen and hear me okay? Okay, perfect. Well, thank you all for joining us today. This is Blackhawk County's Community Forum, and the topics we'll be discussing today are HIV STD community services and kind of the experience that a patient would go through, kind of from testing all the way to care and support services and everything that's in between. So these are our speakers that we'll hear from today. I'm going to start us off with some data, kind of a state of the state of what that looks like across the state and some specific data on Blackhawk County, really focusing on health disparities, health equity, kind of looking through that lens, social determinants of health. And then we'll hear from Blackhawk County, Janine Johnson at the STD clinic services offered there, and the rapid HIV pharmacy testing sites in Blackhawk County with Kelly Stayert. And an introduction to the DPS position, the disease prevention specialist position at Blackhawk County with Rebecca Mulder, and then support services for people living with HIV with Alicia Smiley from Cedar Aid Support System. So that's kind of our format today. We'll each spend about 10 minutes kind of on our presentation. So presenters, when it gets to your turn, just tell me next slide. I'm happy to advance the slides for you. All right. So again, my name is Lexi Hawk, and I'm a regional health specialist, and I'm with the Bureau of HIV, STD, and Hepatitis with our capacity extension program. And we're also known as RHS for regional health specialist. But what I do in my role is provide academic detailing and is on the topics of HIV, STDs, and hepatitis. And what this means is that I provide best practices related to these topics with different stakeholders in hopes that they'll then implement these practices with their workflow when they're interacting with patients. And we have kind of four main stakeholders that we meet with: the medical community, mental health, community-based corrections, and substance use, as it's common that people living with HIV pass through these different health systems. It's also very important for us to have partnerships and relationships with local public health and different community-based organizations, as they may be serving disproportionately impacted populations that may need to refer to different services that we can provide them, kind of that connection piece. So I'll show you our map on the next slide, but there are 4 RHS across the state. I am located in central Iowa. Our focus really is on the rural counties in each of our regions. So I have about 15 counties that I provide academic detailing to, and I've currently been filling in as a disease intervention specialist for close to 2 years as well in a different region of the state. And you'll hear more from Rebecca about what that position is when it's her presentation. So this is a little bit about the area that I cover. So to get us started, go ahead and advance these. I want to talk a little bit about public health, health inequities, barriers to care, and social determinants of health before we get into the data. I'd like you to kind of think about these things as we look at the data and we look at disproportionately impacted populations. Blackhawk County is a diverse community, so I want you to really think about that as we go on through the presentation. And I'll challenge you to kind of think about that as you hear from our different service providers today about the different services they provide in the county. So here you see an image that is split into thirds. And the first image we see there is kind of the public health third and what that looks like. So public health, the principles of public health really, are grounded in protecting and improving the health of all people in all communities. And we know that, this is impacted. We have certain barriers to care that impact the public health principles. And this means that certain groups there are barriers to care for certain groups and communities for accessing care and achieving optimal health outcomes. And then the result of that is we see health inequities that we know are systemic, unfair, and avoidable differences that impact the health system between different health populations. So we have, the goal of public health is improving and protecting the health of all communities that is certainly impacted by barriers to care and health inequities. This next slide really talks about the root causes of disparities, and I'm sure you're all familiar with social determinants of health, but disparities are associated with differences in the social and structural environments, and these differences are known as social determinants of health. Individuals' risk behaviors alone do not account for disparities in rates of HIV infection among racial and ethnic groups. These disparities are associated with differences in the social and structural environments in which risk behaviors occur. So you can kind of see that in the two different tiers there that kind of represents social determinants of health and how they impact each other. And so we'll talk a little bit about this more when we look at the data. I just kind of want to present these first two slides and be thinking about that in the forefront of your mind as we go along the presentation today. So to give you some context about statewide data, we're always a year behind in data. So our 2021 data will be out late in 2022. But this is statewide data for 2020. And in our bureau, we have actually 6 now infections that we cover. We just added hepatitis B surveillance to our bureau as well. But here are 4 that we work with. And so you see the number of new cases that occurred in 2020. And for the time that we have today, I'm going to focus mostly on HIV data for the state in Blackhawk County, really highlighting the disproportionately impacted populations. So the slide that you see here, we see that there were 98 new cases of HIV in 2020. And we've actually not seen an increase in this in the past 4 years. It may be a different story in 2021. We know that COVID-19 certainly impacted our work in this area as well, and the ripple effect, we're still seeing that. So in 2020 compared to 2019, our chlamydia cases actually saw a decrease. We did see an increase from 2019 to 2020 in our gonorrhea and syphilis cases as well. So I just wanted to provide a slide for context about what this looks like across the state. So this infographic shows the disparities among Iowans diagnosed with HIV by ethnicity and race. So about 85% of Iowa's population is white or non-Hispanic, and non-Hispanic Black or African Americans and non-Hispanic Asian Iowans are overrepresented among people diagnosed with HIV in comparison to the sizes of their respective populations in Iowa. Non-Hispanic Black African Americans represent about 4% of Iowa's population, but experienced about 23% of HIV diagnosis reported in 2020. So we certainly see a disparity there. And it's important to note that communities of color are disproportionately impacted by HIV in Iowa, particularly Iowans who are Black or African American or Latino or Latinx. It's important to remember that this is not due to increased risk behaviors among these populations. In fact, the research actually shows that people who are African American or Latino are more likely to use condoms and have fewer sex partners. The disparity is a result of social determinants of health that we kind of talked about earlier, and other factors including poverty, historical trauma, disproportionate incarceration rates among communities of color. So again, we see kind of how social determinants of health plays into this. So here's another infographic that is looking at disparities among Iowa adults diagnosed with HIV by exposure category from 2010 to 2020. And what I'm going to draw your attention to, there are 2 red lines on this infographic here. I'm going to draw your attention to the bright red line, which represents the MSM category, and this stands for men who have sex with men. So from 2019 to 2020, diagnosis increased about 13% among men who have sex with men. And it should be noted that there was no increase in white MSM, but significant increases were noted among MSM who identified as non-Hispanic or Black or African American, non-Hispanic Asian, and multi-race. And MSM, or men who have sex with men, is one of the areas that we are focusing on our Ending the HIV Epidemic Iowa plan for the health equity focus area. Okay. Here's another slide that discusses disparities in viral suppression. So we have a retention in care and a viral suppression rate. And what viral suppression means is that the level of the HIV virus is below a certain level that the HIV virus cannot be transmitted sexually. And this is the best measure for health outcomes for that person living with HIV. That is where we hope we can get that person is to achieve a viral suppression rate. And this is also the best measure to to prevent new transmissions too. Is helping people living with HIV achieve viral suppression. Again, best health outcome measure for them and best way to prevent new transmissions. And that retention in care rate, retention in care means that that person living with HIV, they're on their medications, going to appointments, they are retained in the HIV care system. So we kind of have a retention rate and a viral suppression rate. But here again, you can see disparities among the different groups. And kind of what that means, again, kind of tying it back to social determinants of health and how certain groups have different retention and care rates and viral suppression rates. And this is why it's so important to provide equitable services for everyone. Something that I wanted to bring your attention to on my right-hand side, I think your left-hand side, is a notice that says US born and foreign born. So we are always learning too at the Iowa Department of Public Health, and there are always new and more equitable terms coming out. And so you will see a change in our 2021 surveillance report that it will say non-US born, because foreign born might mean foreign born to whom. So we always want to make sure that we are using the most equitable language. And we're also, looking into and hoping we're trying to get to, just for example, another term we're looking at, trying to get to this term is Hispanic or of Latin descent. We want to really make sure the different groups are represented as they should be. So we're always looking at ways to make the language we use more equitable. So these next few slides will really focus on data that pertains just to Blackhawk County. So you have one pie chart that looks at the population here of Blackhawk County of who lives here, what does the population make up. So you see the white demographic represents about 80% of the population, African and Black or African American about 10%. And we go on, Hispanic or Latino, Latinx population is about 5%. So this looks kind of just at syphilis for 2018 to 2020. And the reason we have a 3-year kind of aggregate data is because we have to have enough data to share publicly. So it's due to viral suppression. So we want to make sure we can report data. We have confidentiality standards we have to adhere to. So that's why it's aggregate data over the 3-year time period. So if you look at the population in comparison to the syphilis demographic for those 2018 and 2020, you can see that we certainly have a disparity. Black or African American represent about 10% of the population, but then about 44% of the new syphilis cases during that time period. So again, we see disproportionately impacted groups here. So this looks at chlamydia and gonorrhea data for the 2018 to 2020 year. Again, keeping in mind the population we just saw that makes up Blackhawk County and disproportionately impacted population. So you can see the rates here and how that does look in comparison to chlamydia and gonorrhea. And this last slide here is really just looking at HIV data. Again, you see the population there on one pie graph, and then you see the HIV breakdown for Blackhawk County, again, from 1984 to 2020. Again, we had to use aggregate data here. But you can see, again, the disproportionately impacted populations. So why am I highlighting this? Why is this important? So it's all about providing equitable care for everyone, right? So services should be implemented keeping in mind barriers to care and health inequities, so that we can protect and improve the health of all people in all communities, and in return have better health outcomes for our communities. So which this goes back to kind of public health, the principles of public health, and really public health being the guardian for all health. So as my colleagues present today in their services, I kind of encourage you to think about the services in terms of looking through that health equity lens, thinking about disproportionately impacted populations, how you'll be able to share this information with different communities that you serve. So I'll just challenge you to kind of think about that today as you hear about the different services that are offered from all the awesome colleagues that are going to present today and the wonderful services that they're providing. So here are some website resources that our Bureau and the Iowa Department of Public Health supports. So we have a number of different websites on here. We have a free condom program that is a statewide free condom program. I think everybody, all the colleagues today presenting all belong to the condom program, and the different websites, resources that are on here. So this is my contact information, and I'm happy to also introduce my colleague, Akoshwa Dasu. Akoshwa, I don't know if you want to give a wave or if you want to unmute yourself or say hello, but Akoshwa is our Health and Racial Equity Coordinator, and she really works with our Bureau to make sure that we're always looking at everything through health equity in the most equitable lens possible. Gosh, have you been here a little over a year, Akoshwa? Is that right?
Yeah,
Yeah.
I have, and Lexi did a great job. I know we have a lot of great presenters who are coming up sharing some really good information. And I just appreciate the opportunity to be here and just learning about this forum. It's a great resource.
Yeah, thank you, Akoshwa. So if you have any other questions, feel free to reach out, to both of us, to Akoshwa. And some of you probably just met Akoshwa on the health equity scans that she might have done with your agencies. So we're very happy to have her here with us and always to kind of have health equity at the forefront, social determinants of health at the forefront of our lens as we do the work that we do. So I'm going to turn it over to Janine from Blackhawk County Health Department. So just tell me when you would like me to advance the slide and we'll go from there. And I think you're muted yet. There you go.
Okay, now can everybody hear me? Okay. Hi, I'm Janine Johnson. I'm one of the nurse practitioners here at the health department. You can advance the slide, Lexi. Okay, so here at the health department, we've got a big long roll, but we have 2 nurse practitioners. We've got registered nurses, LPNs, and our main goal is we want to reduce the rising rates of chlamydia, gonorrhea, HIV, and syphilis. And as Lexi was going through those numbers, I kept thinking, oh my gosh, I'm almost scared to see what the numbers are coming out, because we were shut down for quite a while and people were afraid to go out. They were afraid to get tested. They had nowhere to get tested for a while. So I think we're all going to be really shocked, or maybe not shocked, when new numbers come out. But so we are trying to reduce those rates in Blackhawk County. We're also building some partnerships, kind of outreaching partnerships to increase testing opportunities and treatment opportunities. We'll talk about the different places that we're providing outreach in a minute. So here at the health department, we offer HIV and STD interviewing, counseling, testing, treatment, and education. We hope that we are going to kind of reduce that stigma of STIs and reduce complications. You can advance the slide. So services offered, we do testing for chlamydia, gonorrhea, syphilis. So kind of just in a nutshell, if someone comes up, we're going to ask them to fill out some paperwork, take them to a room. We try to limit our interaction with people as much as we can so they don't see 6 and 7 people. We assure them that it's a confidential environment. We have Iowa's parameters of people that we can see. Anybody under age 24, but anybody that feels they have a partner maybe that had sexual contact with someone else, or partner with multiple partners. We will see anybody with symptoms. We will pretty much, if someone is concerned, they have a reason to be concerned, they can be seen. So we also provide EPT, which is expedited partner treatment. So if someone comes up and they were positive for chlamydia or positive for gonorrhea, and maybe the partner refuses to be seen, they refuse to come up and be tested, we can offer that patient, hey, you can take medicine home for your partner. Otherwise, they're just going to keep passing it back and forth. So we offer that. Let's see, you can advance the slide. We do, everyone that comes, we offer HIV testing, and that is a rapid HIV test. And if anyone comes up positive, confirmatory test is drawn. We do education at the time. Now that we have had such a rising cases of syphilis, we test everyone for syphilis. The Iowa Department of Health has given us the okay to test everyone for syphilis. Previously, it was someone with symptoms, or if they had a past STD in the last year, or someone who was MSM, they automatically got a syphilis test. Now everyone does. Syphilis is in an outbreak status in Blackhawk County. We have had, I think I've almost lost count, people that have gone to urgent cares with rashes and sores, and they get a steroid cream, or they've been referred to dermatology, or they have been told to change their laundry detergent. So syphilis is back. So we are really trying to reduce that. We offer PrEP education and referrals. PrEP is pre-exposure prophylaxis medication. It's a medicine to prevent HIV. Anyone who has had an STD in the last 6 months is supposed to be approached and educated about PrEP. And anybody at high risk should be educated about PrEP and offered. If someone does decide they want PrEP, we facilitate that PrEP referral to our PrEP navigator through the University of Iowa PrEP Clinic. So all the labs can be done here, all the labs and the testing. And then the PrEP navigator kind of takes over the prescription and helping the patient with the meds. So they come up here every 3 months for confidential and free testing. And then the PrEP navigator handles the medicines. We have just been in the talks. We want to start to provide PEP, which is post-exposure prophylaxis. If someone has had a risky event or someone had sex with someone they don't know the status, maybe they were sexually assaulted, they can be on medication for 28 days to prevent HIV. A lot of times we've had people that have gone to ERs and they've been turned away because the ER doesn't know what PEP is, or they don't want to do the follow-up because there is some lab work that is required, and the patients need to be followed, and so I think the ERs just don't want to mess with it. So that's something that we really want to try to offer patients, and so they don't have to go to Cedar Rapids or just not get PEP. That's something else we've been working on. Let's see, I think you can advance the slide, maybe two. That's some of the resources. And you can advance one more. Our main site is the Pinecrest building. It's out in the middle of nowhere, but a lot of people know it as right across from Expo or the VHS building. So I've had a lot of patients say, "Oh, I didn't even know you existed here." So we're going to work on really getting our name out and our location out. We've got a satellite location in Waverly. We do twice a month, and soon in January we are going to start at the ASAP clinic, which is in the Salvation Army basement in Waterloo. It's the free clinic operated by Allen College and the Salvation Army. We're going to start working with them, provide STD services, and hopefully train them and help them possibly doing more testing. So anybody have any questions about what we do or what we provide? I'm not sure if I mentioned when I was talking, in addition to testing, we provide all the treatment. And the treatment is free of charge. We have had a lot of people say, "Oh my gosh, I'm so glad, this is free of charge. I wouldn't be able to obtain this medicine if you guys weren't here." So yeah. Any questions? I can't hear Lexi. Why can't I hear Lexi?
I don't know. It says I'm unmuted. Can you not hear me?
Now I hear
Okay.
you.
Weird. Okay. All right. Thank you so much.
Good.
We will move over to Kelly Stayert with the Iowa Pharmacy Association to tell us about the rapid HIV and hepatitis C testing occurring right here in Blackhawk County. So Kelly, just tell me when you'd like me to advance the slide and I'll go from there.
Yeah, that sounds great. Can everybody hear me okay? Awesome. Well, thanks so much for including this project on this presentation, Lexi. You can go ahead and move to the next slide. So like Lexi said, my name is Kelly Steyert. I work with the Iowa Pharmacy Association. So for those of you that aren't aware of what or who IPA is, they represent the profession of pharmacy across the state of Iowa. So we are a membership-based organization. We work really closely with the Board of Pharmacy, as well as the two schools here in the state, Drake and the University of Iowa, in regards to moving the profession of pharmacy forward. So the work that we do, we divide up into probably 3 different buckets. So one of them would be advocacy. We have lobbyists working down at the Capitol every year in regards to the scope of practice that pharmacists have. So you may have heard, I think in, May or June of this year, the state passed a test and treat law where pharmacists can test and treat flu, strep, and COVID. So, if you would look across the United States in regards to pharmacy practice, the state of Iowa really is advanced in regards to the scope of the work that they do compared to other states. So advocacy is one of them, professional development is another, and then also leadership. So really working and developing the role of the pharmacists and technicians. So that's why it's, we have such a close relationship with the Board of Pharmacy and with the schools. And then the work that I do is just a really small part of those buckets. I'm a project and partner manager. So I oversee a federally funded grant in collaboration with the Department of Public Health, implementing HIV and hepatitis C testing in community pharmacies across the state. And then I also work with companies or organizations that are interested in supporting the work that IPA does. So whether that's partnering with IPA in supporting our annual meeting, educating pharmacists, I work with companies and working out ways that we can work together to ensure pharmacists and technicians have the education and the information that they need to do the work that they do. So with that, Lexi, if you want to go to the next slide, I'll talk to you a little bit more about the project itself. So this project is the testing model within the pharmacy is a replication of a similar project within Walgreens and the CDC. So they actually collaborated in the state of Virginia in 2013. And the project was successful in implementing testing. So that is where this pharmacy model originated and where we kind of, replicated it from. So the project with IPA and IDPH initially started with HIV screenings. In 2022, we'll be going into our 3rd year. And then we also just in this last year implemented HCV screenings. It was actually right in the middle of the pandemic, so in the fall of 2020. The project utilizes InstiRapid HIV test kits and then OraQuick rapid tests for HCV screenings. So these tests are either reactive or non-reactive. So the pharmacist will partner with local public health, which some of you may be familiar with. If there is a reactive test, ensuring that that patient is referred for a confirmatory test. So either with a collaborative practice agreement with a local provider in the community or with public health. So the pharmacist makes that connection with the patient and ensuring that that patient can get a confirmatory lab test. You can go on to the next slide. Thanks there, Lexi. So the advantages of pharmacy when it comes to testing are pretty broad. So Pharmacists are accessible really throughout the entire state. There's a pharmacy in just about every county within the state of Iowa. So it presents a unique opportunity to for pharmacists to contribute to identifying undiagnosed cases of HIV or hepatitis C. I think the latest results or the latest kind of research says that 70% of rural consumers live within 15 miles of a pharmacy, and 90% of urban consumers live within 2 miles of a pharmacy. So pharmacists are just really accessible. And they're really an untapped potential for HIV testing in settings that are more accessible and for some people really less stigmatizing than a traditional testing site. So this testing project, there really provides a small barrier to access. There's no requirement for health insurance or health history, or really an ID. Individuals can just show up at the pharmacy and perform a test and get results immediately. The pharmacy model can also be really convenient. So pharmacies often have typically like extended hours than a traditional testing location. And it's a one-stop shop, right? So an individual may go to the pharmacy to pick up personal items or to fill a prescription, and then they can get an HIV or hepatitis C test with the results immediately. For individuals living with HIV, pharmacists can also counsel patients on medication adherence. So ensuring that they're taking their medications correctly is really important as well. Collaborative practice agreements, I briefly mentioned them in the slide before, but basically collaborative practice agreements put a patient's pharmacist and their medical provider on the same page. So they can see blood test results, any other orders that the doctor may have in regards to that patient. It just streamlines communication and allows the pharmacist to have more information. And then go to the next slide. So the training curriculum when it came to this testing project was pretty thorough. We did an in-person, this is before the pandemic, and then also an online portion. The CDC had recently came out with a training specific for pharmacists. So we utilize their, a bulk of their testing curriculum. We thoroughly reviewed how to use the test kits. A good portion of the training also included a module on counseling on results, and that was delivered by regional health specialists within the Department of Public Health. They continue to be great partners for our pharmacists in the community. We focused on using non-stigmatizing language and delivering results that were in a manner that was clear for both a reactive and non-reactive test. They did role playing. And then we also discussed partner resources that are not only available for the pharmacists, such as the regional health specialists, but also resources within the community, and ensuring that as patients were getting tests, that they weren't just walking away with, okay, I got a negative test result. They were provided resources for additional testing sites, the importance of testing, prep, just a wide variety of resources. And then something else that we talked about during our training was reporting, ensuring that they knew how to report. We talked in detail about ensuring that confirmatory, if there was a reactive test, connecting with the public health department and scheduling that confirmatory test. Yes, and then I think this may be my last slide, just a list of those that are participating in HIV within the Blackhawk County area. So you can see the 5 there that are listed. Greenwood in Waterloo, they are doing HCV and HIV testing. The majority of these, I think they're all really providing walk-in testing services during the pandemic, just because of the busyness and the workflow of pharmacies. They were asking for appointment only, or you could schedule appointments. online, but yeah, you can walk in, or some of them do offer scheduling if you wanted to schedule out testing. And yeah, that is my contact information, my email. I'm happy to answer any questions or give clarity to anything that I presented on.
Okay, thank you very much, Kelly. There are no questions. I think we'll go to our next presenter, who is Rebecca Mulder, and she is a disease prevention specialist with Blackhawk County Health Department. And she's going to tell us a little bit about what she does in her role and kind of where she fits into all of this as well. So go ahead, Rebecca, just tell me when to advance the slide.
Alrighty, can you guys hear me okay? Perfect. So again, my name is Rebecca Mulder. I'm a disease prevention specialist at Blackhawk County Health Department. So my main roles include disease investigations and HIV or STD education. A couple of the other DPSs also do outreach opportunities, whether that's at the clinics or just passing out flyers throughout the community. So next slide, please. So some services that we offer, like I said, are disease investigations. So a couple of things. So we notify patients of positive tests and treatments, or offer treatments and provide counseling. So whenever we notify patients, most of the time their provider has already notified them, but there can be cases of we're the first ones that they get a call from. So sometimes that can be emotional or just a shocking news to hear. So we do provide counseling and make sure that they get the proper education that they need and where to get treatment at. So we work with healthcare providers to ensure patients get those treatment options. So having a great relationship with those healthcare providers in Blackhawk County is so important. Just stressing that these treatments need to be given to patients as soon as possible. And we also can connect patients to local resources in the county as well. And whenever we talk to patients or cases, we always tell them that everything is confidential. So if they do tell us any contact information, we're able to connect with their partners to encourage testing and treatment as well. So go to the next slide, please. So another service we offer is outreach and education, condom distribution, and PrEP services. So like I said before, we provide educational pamphlets and materials to our patients. So whenever we have either a testing event or if they ask for more information, we're more than happy to send them a pamphlet or anything like that. We do have pamphlets on each STD, whether it's chlamydia, gonorrhea, syphilis, and even one on HIV specifically for that STD. So they're able to get just general information where this how they can get this STD and some signs and symptoms as well. So we do promote HIV and STD testing that's done at the clinic. So I do stress the importance, again, of getting testing, getting proper treatment, and also making them know that our services are absolutely free. So that's super important. Distributing condoms throughout the community. So we distribute condoms through either barbershops, hair salons, restaurants, bars. Those are just a couple of places that we distribute condoms to. There's definitely many other places, like we distribute them at UNI as well. And then we also encourage the use of pre-exposure prophylaxis, the PrEP pill for those who are at risk for HIV. So this can be the MSM community, anyone who's transgender, or anyone who has multiple partners too. You can go on to the next slide. So here are some resources I wanted to share with everyone. So this is the first one is the My Iowa Condom. So you're able to see throughout the state where there are available free condoms. So I think that's a really good website to look at. There's also the Stop HIV Iowa website where people can learn more information about HIV and where HIV testing is located throughout the state. And then the same goes with Prep Iowa. They're able to see where where you're able to get PrEP at too. So you can go to the next slide. And then that is all of my contact information. So that has my office phone and email. So if you had any questions, you can either email or call me. So does anyone have any questions?
Okay, thank you very much, Rebecca. All right. And next we have Alicia Smiley with Cedar AIDS Support Services, who is going to discuss their services. Alicia, feel free to just tell me next slide whenever you're.
Okay, thank you. You can go to the next slide already. Hello, everyone. My name is Alicia Smiley, and I am an HIV case manager with the Cedar AIDS Support System, and we are a program located in the agency called Cedar Valley Hospice. First, I want to give a shout out to Monsoon because I see some Monsoon staff on, and I did 13 years in domestic and sexual assault victim advocacy services. So I want to say, good job, Monsoon. Keep up your great work. And so, yes. We are in Cedar Valley Hospice. We are a small program of 3 case managers. Our supervisor is Elizabeth, and she does half a caseload of people living with HIV. And then Kelly and myself are 2 full-time case managers. And so we work 8 to 4:30 Monday through Friday, and just are happy to serve the people that we get to meet. Our main focus is to listen, support, and offer compassionate services without judgment. And then after that, we focus on connecting people living with HIV to the medical care that they need, to insurance to help cover those medical bills and the medication. And then we help them with access to medicine. So if the insurance can't pay for all of the medicine, then there are other programs through the Iowa Department of Public Health that we have access to get them connected with to help pay for their medicine and for their medical care. We really don't want medical bills and pharmacy bills to be a barrier for people to continue caring for themselves. And so those are the 3 main focuses that we did. And then after that, we try to identify any other barriers to meeting the needs of the people that we serve. So for example, some people might have transportation barriers to getting to doctor's appointments. They might not have enough food to last for the month or some safe shelter. And so if they talk to us about any of their other needs, we will help connect them with other agencies in the community that can help meet their needs. Go ahead, next slide, please. Thank you. So again, for case management, the list of, I broke down our services really quick: case management, and then financial support and referrals. So we connect people with virology doctors. We give people options as far as where they want to receive their care. There are doctors out of the University of Iowa hospitals and clinics in Iowa City that can provide that care. And some of them even come to Cedar Falls to an outreach clinic twice a month. There's also a local virology doctor named Dr. Patel in Waterloo with the Mercy One. And so we give them that option to receive services locally also. We review their insurance if they have some. Elizabeth is trained as a SHIP insurance, I don't even know, person to help with insurance. And so if we are unsure if their insurance will cover their meds, then she will review their insurance and kind of give them guidance on anything else they might need. And then, like I said before, we will connect them with Iowa ADAP, which is a program that can pay for medicine copays. If somebody doesn't have insurance and doesn't have access to insurance through their employer or through Medicaid, we can also put them on insurance through ADAP. So that's kind of nice that we have that last option to get people covered. And we're advancing still. And then, of course, like I said earlier, the medication, it is very, very expensive. HIV medicine is expensive, and many times insurance programs require people to use specific pharmacies. And so we have the ADAP program, the AIDS Drug Assistance Program through IDPH to help people pay for their copays, get connected with pharmacies to try to make them the process seamless of getting the medicine in their hands. After that, we can offer financial support. And so monthly, if people qualify for services, which I should have said at the beginning. So to qualify for case management services, you have to be at 400% of federal poverty level or below. And so at that point, we can offer financial support. Our program specifically offers monthly grocery cards. So we will give $75 to Hy-Vee or Fairway, and then $50 to Walmart. And the people that we serve just need to give us a call and ask for their grocery cards, and we can send them out. Other financial support we offer is help paying utility bills. We have a few different funding streams that can help with that. So based on the scenario and the circumstances, we can use different funding streams. Sometimes people have a major expense come up, like a car repair bill or something else, and they might need help with rent. And so we encourage them to let us know, ask us, we will apply, we'll go through the steps. And if we can help them, we'll let them know we'll pay rent so they can put their money toward paying their car bill. And then eyeglasses or contacts is something we can help people with. Our program specifically helps with up to $150 toward eyeglasses or contacts. And then there's medical bills and medicine copays. Sometimes people get medical bills in the mail. So we just remind people that we serve that you can give the bills to us and we will pay them for them. And then the referrals again. So if we can't meet the need for somebody, then we give them the names, the phone numbers of agencies that can. If they aren't comfortable calling those services themselves, we're happy to make a conference call with them to kind of support them making those calls to the different agencies. Something else we offer is transportation. Under the financial support, I should say transportation. So some people can't get to doctor's appointments, and so we're happy to provide gas cards, taxi rides, or bus passes so people can get to their doctor's appointments. Next slide, please. The resources that help fund our services are the Ryan White federal funds. There is HOPWA Housing Funds, which is out of the Iowa Finance Authority. There is Broadway Cares Funds, and so that is a group of Broadway performers that put money toward their Broadway Cares that we apply for every year, and we receive some funding from them. And then, of course, there's local community funds and donations, private donations from the community. So all of that helps fund the services. All of our services are free and confidential. We function under HIPAA guidelines, and so we can't confirm or deny that anyone is receiving services from us unless they've signed a release of information. And then a few links that I provided are the links to our specific program on the Cedar Valley Hospice website. I also provided that Cedar Valley Hospice website link, and then Stop HIV Iowa page. If you're unsure, I'll quickly say that Cedar Valley Hospice offers end-of-life services, in-home, in nursing homes, or in our hospice home. And so if somebody or a family is considering some in-home care for somebody at the end of their life, Cedar Valley Hospice is an option for you for that. But, next slide. And my contact information and our program phone number. So that phone number goes to the CAS department. If you want to speak specifically to me, just ask for me, but you can talk to any of us, Elizabeth, Kelly, or myself. The cas@cedarvalleyhospice.org email will go to all three of us. We all have access to that email. So if you email me and I'm on vacation or not in the office, then nobody else can help you. But if you email CAS, then anyone can see it and anyone can respond if I'm not available. And our address, we were lucky enough to move into a new building this summer. And so we have a permanent place and we don't have to move our offices around anymore, this community. So we're happy to say we're permanently in Waterloo on Tower Park Drive, which is near the corner of San Martin and Amesboro. Like I said, we're Monday through Friday, 8 to 4:30. If people need services after that or outside of those hours, we're happy to stay late or come in early to serve people. They don't always have to come to our office if they're uncomfortable with that. We are happy to meet them in a place that they feel safe and comfortable talking about their personal needs. So, I think that's my last slide. Are there any questions or did I forget anything?
Thank you so much. And thank you to all of our presenters today. And we're wishing all of you a healthy and happy holiday season. And I am going to stop sharing my screen and we can open it up if there's any questions for the larger group. I know I have something I was going to add. Alicia, can you talk a little bit about how the services that you provide kind of play into retention and viral suppression? And can you talk a little bit about how that helps?
Sure. So we know from research that if people living with HIV have a case manager, that they're more successful, more likely to be retained in care, more likely to go to their doctor's appointments and retain access to their medicine and take them daily. Whenever we have somebody new that we're serving, we make a few goals with them and strive to talk with them at least once a month. So then we can talk to them about how they're feeling about their diagnosis, how are they feeling if they're new to the community, even if they've been diagnosed in the past, and try to build relationship with them, build trust, just so they feel hopefully comfortable and confiding in us and reaching out to us if they need help. And then as people show that they're going to stay in care, go to their appointments at their doctor's request each year, take their medicine. Ideally, we will see them become suppressed, which is a viral load of under 200. And then the most ideal would be to see that their viral load is undetectable. And so that's the biggest goal, is to support them to getting to that point. And then if they're doing well and they're stable and they agree, we move them to a different level of case management. That could be a non-medical case management, which is at minimum talking with them every 3 months and going over some goals still with them. It might be language barriers that we support, or transportation, or they might have some relationship struggles, and so we can support them through that. So, and then after that, if people continually show that they're suppressed or their viral load is undetectable and they're going to their doctor's appointments and don't have many other barriers that they need support with, we move them to a brief case management level, which is a minimal requirement of talking to them and reviewing their medical situation and personal things twice a year. And so some people, many people are actually at that level of care. And so we talk to them every once in a while if they reach out to us, if they want grocery cards, but some people we really just review everything twice a year because they are doing really well on their own and don't require our services. People that are over the 400% federal poverty level can stay on our program. They're at a 4th level of services called MOS, and they do not qualify for financial assistance, but we can keep them on our caseload to help them maybe with their annual review of insurance. So like Medicare changes every year, or ADAP sponsored insurance might change, Marketplace. So some people like to stay on a caseload. We talk to them once a year to review everything. They can call us whenever they need, but the primary focus is their insurance and stuff like that. So.
Thank you very much, Alicia. I just think it's important to highlight how important those services are, to help folks achieve the best health outcomes possible. So I hope you all were able to see today how collaborative this group is, and how, we kind of help through the patient experience of going into access testing services, whether that's at Blackhawk County Health Department or through the Iowa Pharmacy Association testing site. And then, kind of through the GIS work, how Rebecca might help connect someone to care, other resources, other testing, and then along to support services. So I hope you're kind of able to see the whole process that experience a patient might go through and what resources are right here in Blackhawk County. One thing you highlighted, Alicia, about the different kind of case management, you really do meet people where they're at, and that's why there are different tiered approaches, as different folks have different needs. And so it's really a tailored approach. And I'm sure you all implement different tailored approaches in your work to kind of, meet the patient where they're at, meet that person where they're at. So thank you all for the work that you do in helping our community be healthier. Alicia, looks like you have something.
Yep, I just wanted to let people know that I am a bilingual case manager, so I speak Spanish. So anybody who that is their primary or preferred language, I'm happy to help them. And then for people whose primary language is not English, we use interpreters, whether it's locally or through language lines. So the staff that answer the phone understand that if someone calls and just says Cass or says my name, we will get an interpreter very quickly for them. So
wonderful. Awesome. Are there any other questions, comments, discussion?
Jake, I see that you're on the call today. If you can hear us, did you have any questions about the stuff that was discussed today?
No, not really, but thank you. I think it's good information. Probably we can focus on that more every now and then.
Yes, very good. Okay, I think I'm going to stop recording now, so I'm going to hit stop on that.